Boy, I love the low-key bumpers, Robin. It's just,
Yeah, me too.
Just like there. When's it going to start? Take a while to crank up, right? All right, we have a really important topic to talk about. We have some people in the studio to help us with understanding hepatitis A, I think specifically. In the studio, Christy Juergens is here. She's the Public Information Officer for the Florida Department of Health in Marion County. Let me turn on the camera so you can see everybody that's here. Mark Lander is with her. To her left. Mark is the administrator of the Florida Department of Health in Marion County. And then to Christy's right is Dorothy Graybell. She's a registered nurse. And they're all here to talk to us about hepatitis A, the virus, not to be confused with the rock band. Imagine that. That'd be a horrible name for a rock band, wouldn't it?
Yeah.
A vaccine-preventable form of infectious hepatitis. Okay, that vaccine-preventable is an important part of that, isn't it? So good morning to all three of you. Thank you for coming in.
Good morning. Thank you for having us.
Yeah, that would be a bad rock band name, wouldn't it? That's not a good one, huh? So is this something what is hepatitis A? I guess we'll start with the most basic of all questions, right?
Mm-hmm.
What is it?
Hepatitis A is a highly contagious liver infection, which is caused by the hepatitis A virus.
Okay. That sounds scary when you say liver. Mm-hmm. That's bad stuff, right?
Well, hepatitis A isn't that bad. It can range from a mild illness lasting a few weeks to a severe illness lasting several months.
Oh, really?
Yes.
So we might have had it and didn't know it?
Correct.
Would you know if I had it?
You'd have to be tested.
There's a way to find out?
There is a blood test.
What, does it change me forever?
No, you will just have immunity to hepatitis A.
I would. Yes. Well, that's a good thing.
Yes, it is.
Okay, so then I wouldn't need the vaccine anymore, right?
Not if you had a case of hepatitis A before.
Oh, my gosh. Okay, so what would happen if I had the vaccine, but I was already immune to it?
Nothing.
Nothing? Should be okay?
No. Yep.
And how would I get it? How do you get this disease?
Basically, you get it by what we call a fecal-oral route. So if somebody didn't properly wash their hands after they went to the bathroom.
That just doesn't sound like a route I want to take.
No.
Fecal oral route.
They touched touched a piece of fruit or something that you didn't wash.
Yeah.
You ate it.
That's as easy as that. Okay.
Or you can touch things that they have touched and then touch your mouth
And before we go any further, is A there's got to be a B if there's an A, right?
Well, yeah, there's a number of hepatitis, but ones we are concerned in this country is hepatitis A, hepatitis B, and hepatitis C. Okay,
so B and C, are they vaccinated? I mean,
B you can get a vaccination for, but not C.
Not C, okay. And is one of them deadly?
They all can be.
They all can be?
Yes, sir.
Oh, my gosh. Okay, so how are we doing in Marion County with this?
Well, currently we're seeing a large increase in the number of hepatitis A cases.
Really?
We have seen 44 cases since the start of the year. And that is really unusual for us because, say, in the year 2015, 2016, 2017, we only saw one case each. We started to see an increase in cases over the summer. And then obviously this year we've had 44. And this has kind of mimicked cases across the nation and across the state of Florida where we've seen this increase in cases.
Do we know why? Do we have an idea?
Well, I think what we've, when we're experiencing what Christy was talking about, with in Marion and seeing across the state and the country is there's multiple factors that can come into play. We look at homelessness and we look at our drug abuse system and what's currently happening in Marion County. Also our MSM, the male having sex with male population can cause an increase. And when we really look, and I think you can look across the state of Florida, you see those trends specifically in the homelessness and the injection and non-injection drug use can lead to these increases.
Okay, do the cases appear in those communities, or am I at risk by not washing my hands when I use the shopping cart? Because I use that shopping cart thing. Every time I have one of these conversations, I use the shopping cart thing. Okay.
You're at risk from anything that anyone ahead of you
has
touched, and may on that shopping cart, on key punches. The best thing, if you want to talk about the best way to prevent yourself, number one is vaccination. That is the best.
That's the best way. Okay.
And then, do you want to talk about hand washing?
Good hand washing technique using soap and water. The alcohol-based ones that they have out, the pumps, that does not clear Hep A.
Really?
Correct.
So that wipe that they give you at the Publix?
Yes.
That helps or no?
It'll help a little bit,
Yeah.
but it's soap and water is
Soap and water.
really is the only thing that kills it, yeah.
All right.
That's one of the reasons why we encourage people to wash their hands with soap and water before they would drink anything or prepare any food. Certainly.
So if
I always do that before cooking and
Yes.
during cooking. You know, if you got stuff on your hands, I always go to the bathroom and wash with soap and water.
Oh, I'm going to be doing it more often now. So when you've had it already and you're immune, or you've had the vaccine and you're immune, can you still pass it on to somebody else?
No, because you don't have the virus. You only
No.
have the antibodies in your bloodstream. You don't have the virus anymore.
Oh, okay, okay.
But it is easier to spread hepatitis A if you're around someone. It's easy to get hepatitis A if you are around someone who has hepatitis A, just because it is so highly contagious and it's difficult to kill on surfaces. It can live on surfaces for a month or more.
Months, yeah.
Do you know what I always think of, like when I go using the shopping cart is, because I think that's my biggest thing. That's my biggest fear. I'm afraid of shopping carts.
Yeah.
You go to the store and you know babies sit in that little area. And I like to put my food in that little area. I don't know why, because I'm lazy. I don't want to bend all the way over to get my corn out. You know?
Fair enough.
All right, so
I'm not going to say I've not been there.
you do that thing? All right, so I put it where the baby sits. And I think, what if the last baby had a leaky diaper? You know?
Well, I appreciate you bringing that up because I wasn't thinking of that before, but now I am.
But I mean, I don't mean to be silly or anything, but could that happen? Or would a baby not have this disease?
No, it affects all ages.
It does. How would a baby get it, though? From the mother, maybe? Really?
And if a person has symptoms, can it be misdiagnosed sometimes by the doctor?
Well, a lot of the symptoms are nausea, vomiting, diarrhea. So it's common stuff. The later symptoms that you get, which would be jaundice, which is yellowing of the skin and the eyes, and your urine turns dark like a iced tea color. That's the real telltale symptoms that we see. But the other ones, it could be mistaken for anything: a cold, a flu, a stomach virus.
But there is a blood test.
There is a blood test that we do.
they
that
would
can-
use to confirm whether or not someone has hepatitis A.
And if you do confirm somebody has hepatitis A, how long does it take to make everybody normal again? Get rid of
It
the
can
symptoms?
take weeks. It can take months when you have it. It all depends because
Oh.
there's no antibiotic or treatment for it. You treat the symptoms.
Oh my gosh.
That's true.
You're not treating the virus, you're treating
Correct.
the symptoms of the virus. But then that's important the quicker we can identify an individual, because then we go through our processes of our epidemiological investigation. We tie in contacts, because there may be individuals who are contact to this person, and then we can get them vaccinated for protection.
So Robin sprays the headphones with Lysol. Is that a
And
good
the
idea?
microphones.
And the microphones.
That's still always a great
So you're
idea.
you're protected, because I need you to put the headphones on in order to hear. You have a caller calling in.
So you have.
So yeah, in order to hear the caller, you'll have to have your headphones. I just didn't want you, because if I were in your job, I'd be a germaphobe for sure. I think I'm already one just by listening to what you're saying. All right, you ready?
Sure.
Good morning. Thank you for calling. You're on the air.
Yes, thank you. When you go for your yearly blood work, your examination you're on a yearly basis, and you do what they call a lipid panel, would your liver test or deficiency in your liver come up on those tests, or do you have to ask for that for your doctor to look for that?
Good question.
You would have to ask your doctor to do a chronic hepatitis screen in order to find out if you've had hepatitis A.
Okay, so it wouldn't automatically.
Yes, so he's breaking up. It sounds like it wouldn't automatically be tested
No,
for.
no.
Okay. But that's true for a lot of diseases, isn't
Correct.
it? So we got to kind of have a checklist for the things we're worried about, right? Or think we might have been exposed to.
Yes, sir.
Right? All right, keep your headphones on. It looks like we have another one coming in. Good morning. You're on the air. Thank you for
Good
calling.
morning. This is Kathy. I just got a question. When I was about 11 or 12, I had hepatitis A, very brief period of time. It kept me from donating blood all through my 20s. And all of a sudden, when I was in my 70s, they accepted my blood. What made the difference?
Sometimes different blood donation standards have changed just as medical understanding as far as risk has evolved.
Oh, really? All right.
I'm really happy I can donate now. Anyway, okay.
So are we.
Yeah, thank you.
Thank you.
So she couldn't donate when they. So oh gosh, we donate all the time. I would hate to be told that. So when you donate, do they automatically test? So would I get a note from Life South that says, you can't donate anymore.
I would have to get the specifics from Lifestyle.
You're not sure? Okay.
I'm not as familiar with that. But I know they have a whole series of things that there are a whole series of reasons why they may or may not want someone to donate blood.
So are you guys here to, do we have a vaccine program that we're doing?
Yes, we're doing many vaccination opportunities right now in the community. The one that we're really trying to get people to come to is we have a drive-through hepatitis A vaccination.
Drive-through?
Yes, drive-through vaccination.
Put your arm out the window?
Clinic. Yeah, it can be that simple. If you have a bunch of people in your car, we might, suggest you step out just to kind of streamline things a little bit. But it'll just make it a quick process for someone to come to our department, get their hepatitis A vaccine, drive on out and just have a great day, and then be happy and secure knowing that they're going to be protected from hepatitis.
Well, we're going to keep announcing this beyond
Please
this
do,
interview
yes.
right now, okay? So it's April 27th?
Yes, April 27th. It's a Saturday from 10 to 2. And as well, people can come to the department during normal business hours and get their hepatitis A vaccination. And I'd like to emphasize it is for free.
Oh, for free?
Free hepatitis A vaccination.
Have you had it?
I'm getting one this week, actually. I was going on vacation, so I held off for just a couple of days. But
Do you have to wait like a couple of days after you get it? Do you feel something at all? No?
Sometimes you can get your muscle may be sore.
Oh, that's it?
That's it. Sometimes you may feel just a little achy, and that's just your immune system picking up on it and making those antibodies against it. That's a good thing.
Do you have to check with your physician first before you get the vaccination?
There really is no contraindication to it unless you are allergic to the hepatitis vaccine.
Mm-hmm. And then how often do you keep getting keep getting vaccinated?
You
then?
get the initial vaccine, and then 6 months later you get a second booster shot.
And I think what's important to recognize here is how effective that first vaccination is. It's very, very effective by just having that first dose, but you need to get the second to follow up.
And then you're done for the rest of your life?
And that's it.
Mm-hmm. The first vaccine will give you 95%.
Oh, really?
Protection, and that usually lasts up to about 11 years. If you get the booster, it lasts you up to about 25 years.
So you want to be really busy? Because we can make you really busy.
Absolutely.
Yeah?
What we loved is we did this similar, what was it, last year for a year ago for flu vaccines. We did that drive-through pod, and in about 3 hours we vaccinated almost 200 people.
Wow.
So that's why we're hoping to get with this hepatitis A pod as well.
And when they go to get this vaccination, what kind of clothing should they wear? Does it, they have to have a sleeve that you roll up,
yes.
or?
It makes it a lot easier. Don't do what
I would think
I did.
so.
I had my long sleeve shirt on. And
Did you? A jacket, winter
in the middle
coat?
of a meeting. It wasn't a pretty sight, so I wish I would have worn short sleeve that day.
Why do you suppose that there is such a huge outbreak of this now?
Well, we've seen it happen across several of the states. It's a trend that's happening across the
really?
country.
It's not just here?
Unfortunately, no, and it's here in Florida as well. And because it is highly contagious, it makes the particular virus is vulnerable to being spread more easily, particularly among groups who may not necessarily follow, who may have trouble with sanitation or whatever else. So that's where individuals like our homeless are incredibly vulnerable to the spread of it. People who use drugs, whether they're injected or not. People who've been recently incarcerated are at risk as well.
Oh.
And of course, anyone who cares for or lives with someone who has hepatitis A.
Mm-hmm.
Oh my gosh! And if you're, if you have a new baby in your family, you definitely don't want to bring it home.
Oh, sure.
Right?
Yeah, I don't want that.
I can see that, right?
Well, how young should the children be when they come to your event on the 27th
Oh,
of
do you
April?
vaccinate children?
1 and over.
1 and over.
So the little babies put their hand out the
No,
window too?
they would have to come out of the car.
Oh, okay.
We had it set up before to where there's several sections. There'll be a drive-through location, and we also have, for individuals who just aren't comfortable in that setting, we also set up several locations on property where they can move over. We'll have a bus set up. They can go over to that location, or just some tents that they can go into as well. So you're not isolated.
Okay.
The idea is getting it on, number one, an opportunity for individuals who can't come see us Monday through Friday due to whatever reasons. We can make it available.
Oh, okay, but we could just come and see you.
Any between 8 and 5 on Monday through Friday.
Do we need an appointment, or
you walk in for our immunizations department, and you would just tell them what you're there for, and
Really?
and they can provide that service.
Where are you? Where's the health department?
1801 Southeast 32nd Avenue in Ocala. It's right behind the YMCA and next to Derby Gant Park.
Oh, okay.
If you're
okay.
a landmarks person like I am.
Yeah, me. That's exactly. Yeah, I know. Robin is good with this, that, and the other thing. And you have to tell me it's next to McDonald's. I know where that is.
Hey, it's food. If you want me to find someplace, narrow it down to a food location.
So if you're part of the communities you mentioned earlier that may be more at risk, it doesn't mean. I mean, if you're not part of those communities, it doesn't mean that we're safe. It sounds like it could be anywhere.
Yes, that's correct.
Could I get it from shaking somebody's hand?
You could,
Yes.
possibly.
I shake hands all day long. Did I shake your hand? I think
I'm
I
going
did.
to wash.
I think I did.
I wash before. I'm going to wash when we leave here.
We're from the health department. We wash our hands often.
Do those antibacterial soaps make a difference, or does it matter what soap we use?
It doesn't matter what soap you use.
Yeah, 'cause that's what we have, antibacterial soap, red and green.
Do you remember that brown soap when we were younger? You might be too young, Christy.
I'm not sure.
That brown soap. What was that brown soap we used to use?
Lava?
Lava.
No, not lava.
Okay.
I remember lava too. But what was that real crappy brown soap?
Oh, I don't remember
My
that.
father used to want me to wash the dog with it.
Lye? I don't remember.
Anybody remember what that was called?
I can't remember.
Okay. Smelled bad.
Brown soap.
That's bad. Even the dog didn't appreciate it.
No, it was supposed to be for the fleas. Who knows?
You had said earlier that this can be sexually transmitted, so that means that condoms don't work.
That's true.
Condoms don't work?
Condoms don't work for this.
Really? Why?
It's the nature of
So
how
those little the germs are so small they can swim through that rubber?
No, they don't swim through it. It's just that you don't get adequate protection from just using a condom because it can be in different areas where the condom isn't covering.
Oh.
Right.
Skin to skin.
That is
okay.
so nasty.
Gosh, this is so scary.
So think if someone just goes to the bathroom and they don't clean themselves well,
Yeah.
and they don't,
Yeah.
wash their hands
That's
well.
everybody.
It's quite easy for it to spread them that way.
Yeah, okay.
Is the homeless population in Ocala being encouraged to get this shot?
Yes, absolutely. We've been going to many different homeless events, whether it's going to soup kitchens or other feeding events, and making sure that we're helping that homeless population. We've had several outreach events going to where homeless populations live out in the county as well, and getting them vaccinated for hepatitis A. We've been going to the county jail and vaccinating new people as they come into the county jail there as well. We've been going to drug treatment centers. We've gone to the centers, and then we've had just a multitude of public vaccination events, and then as well as going to as well as vaccinating the different people who work with those at-risk populations because they're vulnerable as well to the spread because they're working with clients who might be more vulnerable.
And Dorothy, that must be very scary for you as a registered nurse because you have to have all sorts of protection from everybody.
Yeah, but we learn that when you're in school. Universal precautions is what we call it. You basically kind of treat everybody that has something to protect yourself.
Oh,
so
my
it's
gosh.
multiple hand washings, using eye protection if you need it, or gloves and things like that.
Christy, do you have like a pre-recorded, like a 30-second announcement that we can run on the air?
I can send one to you.
Do you have one?
I can develop one.
Because if you need help, you can record it here.
Okay.
Do you need to record one?
Sure.
Oh my gosh.
That'd be great.
Because then you can take it and you can send it to the other stations. We're okay with that. We just want to help.
That'd be beautiful.
Yeah. So what did you say? Can you stick around? Not
Draft
stick
one
around,
up
but
real quick. Yeah, I can make that happen.
I can maybe run in there real quick and you just sit and
Okay.
record it, and Robert will turn it off, and later on we'll send it to you so you can approve it.
That'd be great.
All right? Just a
Yeah.
30-second little thing.
Thank
all
you
right?
so much. I appreciate it.
Because we'll run it over and over and over, and then you can send it to every other station. It's okay, right?
That would be fantastic. I really appreciate any
Because I
help.
know Robin brags about you, so I know you know how to do it. So
This is going to cost me, isn't it?
no, we're not trying to sell you anything. Oh, she's going to charge you. Oh, really? Are you the boss?
Yes, sir.
And Mark, you have worked with environmental health with different counties. What is one of the main things that you have seen outbreak in those counties?
I think it's when we look at it's very like we talked earlier, it's very similar from county to county. Even whether it's a rural county or even some of the metro counties, you still see the same issues, and it turns down into the protection of the most vulnerable populations, which become our homeless populations and individuals that don't necessarily have those services readily available to them. So that's really why core public health is the health department going out. We always talk about you don't practice public health inside four walls. You practice it getting out, doing an outreach. I think you sent me a list the other day. Since January, we've done like 29 outreaches.
We're over 40 now.
We're over 40 now. Since
nice.
Just since the start of the year.
Just going outside of the health department and trying to get to individuals who may otherwise not be able to reach our services, and that's the biggest thing, and it's consistent from all 67 counties.
And the better you do your job, the safer we are. So that's a really good thing. I was watching this video yesterday, and you've seen this. The train in India. It's covered with people. There's people on the roof of the train.
Yeah.
Have you seen this? They're hanging on. And I said to myself, that would never happen around here because the police would say, get off of the train, right? So what? They must not have the funding or whatever to pay for a police department. And in the same way, we need to support what you're doing because to stay safe, from whatever it is that might hurt us, right?
Public health is preventative medicine. The better we practice and the better we do our jobs, the less you'll wind up individuals in emergency rooms, hospitals.
Right.
It's really the practice of preventative medicine.
What is with the homeless population that would make them more likely to have it? What are they doing? Are they sleeping in places that's not good for their health? And
go ahead.
They may not be able to practice proper sanitation.
Just they don't have a place to wash.
That's one aspect of it.
May not have access to the soaps and everything else that we have. Poor sanitation practice. Congregating in areas, again, it's easy to transmit. Sharing of food, it's just very easily transmitted.
Oh, really?
Because that is part of the thing with hepatitis A is it can be transmitted on food, drink, any objects that you touch. So if one person has it and you're not necessarily able to, wash your hands frequently, or if maybe you don't have a lot of food and so you're sharing food with one another.
So next time I go to Subway, that guy says, "Can I have a bite?" I'm not saying okay anymore. I'm not saying okay.
And we tell people don't share your food or your drinks. Don't share your utensils.
Do you speak Spanish?
Or cigarettes?
I do speak.
You do speak Spanish?
Some.
Well, when you're here, you're going to be here in a little while, right? Because we don't get off. Well, no, you do as soon as you get off. Robin will help you.
Okay.
But if you can do a Spanish one, we won't play it here because we have an English-speaking listener. But there might be a station out there that can use it.
Sure.
Send both of them. Let them make the decision,
Sounds good.
So if a person has a friend and they notice these symptoms in their friend, how do they suggest to them that this might be hepatitis A? Because hepatitis is a very scary word.
What they can do is say, gee, your skin looks a little yellow, your eyes look a little yellow. Are you feeling okay? Maybe you should go to your doctor or go to the health department and get checked out.
Mm-hmm. So all people have to do is just go to the on-site health or the on-site health department if they don't have a doctor, and you will take care of them.
So I have an important question that I should have asked earlier. If somebody has a liver disease already, tell me what they should know about the vaccine, maybe, and how could hepatitis A make them worse?
Okay. Well, anytime your liver is compromised, having any kind of liver disease or inflammation, like even hepatitis C or B, it's always good to get the vaccine because it helps protect your liver. It prevents your liver being stressed by another infection.
Oh, okay.
So yes, if somebody has a chronic liver disease or severe liver disease, we do recommend that they get the hepatitis A and B vaccinations.
Okay, so they're okay if they have it already, have some kind of an issue already.
Absolutely.
My mom had jaundice, is that what you call it, where the skin gets yellow? Mm-hmm. In her case, she had cancer happening, and she's gone now, but she had something about the ductwork between the pancreas and the liver. Am I saying it right? Mm-hmm. Yeah, something happened there to her.
So we can go through your drive-through hepatitis A vaccination clinic.
That's right. April 27th, 10 to 2. Come on down and see us. Of course, or during Monday through Friday during normal office hours, 8 to 4:30 or 8 to 5, and come get your free hepatitis A vaccination.
Excellent. And we're going to have a recording from you so that
Yes.
we don't get it wrong. You'll get it right. Thank you all. Thank you for coming in, and thank you for the good work you do for all of us.
We appreciate everything
Thank you so
you're
much for
doing.
having
Thank you for having us.
All right, we'll be right back. This is WOCA Ocala.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages.
Fox News, I'm Chris Foster. The WikiLeaks founder Julian Assange, arrested in London this morning, is now charged in the United States with conspiracy to commit computer intrusion. The arrest was part of an extradition request. Assange had been living at Ecuador's embassy in London for 7 years. He's accused of working with U.S. intelligence analyst Chelsea Manning to break into a classified government computer. Manning served 7 years and is now back in prison for refusing to cooperate with the WikiLeaks investigation. Vermont Senator Bernie Sanders introduces a Medicare for All single-payer health care bill.
More than a dozen Senate Democrats have joined as co-sponsors, including rival presidential candidates Kamala Harris, Cory Booker, Elizabeth Warren, and Kirsten Gillibrand.
This has to become the next social safety net.
Other Democratic leaders, however, are not on board, advocating instead to shore up the existing health care law.
Fox's Jared Halpern on Capitol Hill. This is Fox News.
Finding great candidates to hire can be like, well, trying to find a needle in a haystack. Sure, you can post your job to some job board, but then all you can do is hope the right person comes along, which is why you should try ZipRecruiter for free at ZipRecruiter.com/free. ZipRecruiter doesn't depend on candidates finding you. It finds them for you. Its powerful technology identifies people with the right experience and actively invites them to apply to your job. So while other companies might deliver a lot of hay, ZipRecruiter finds you what you're looking for. The needle in the haystack.
4 out of 5 employers who post a job on ZipRecruiter get a quality candidate through the site within the first day. ZipRecruiter, the smartest way to hire. And right now, you can try ZipRecruiter for free. That's right, free. Just go to this exclusive web address, ZipRecruiter.com/free. That's ZipRecruiter.com/free. ZipRecruiter.com/free.
Here is your 1-minute news brief. A 26-year-old Ocala rap recording artist has been arrested after it was discovered that a song he posted on Facebook had words in its lyric that mentioned a threat to conduct a mass shooting on the campus at the University of Florida. The Pinellas County Sheriff's Office has arrested a 31-year-old man who threatened in an email to slaughter his former coworker.